This is Rehabilitative Medicine with Dr. Jonathan Whiteson.
Words of medicine. I like that. Words are good medicine. But sometimes you have to take medicine, pills medicine, liquids medicine. And it is Talk About Your Medicines Month. Welcome back to the Rehab Show on Dr. Radio, Sirius XM, Channel 110. I'm Dr. Jonathan Whiteson, and my next guest is Dr. Linda Bernstein. Good morning, Linda.
Hello, Doctor. How are you?
I'm very good. Thank you so much for joining us.
Thanks for having me. We appreciate the opportunity to talk about your medicines.
Well, not my medicines in per se. All of our medicines.
Yeah.
I can always talk about my medicines. Dr. Bernstein is a doctor of pharmacy. She got her Doctor of Pharmacy degree, specializes in the development of innovative educational programs for health professionals and consumers. She's a volunteer clinical professor at UCSF School of Pharmacy and recently partnered with the National Council on Patients' Information and Education and FamilyWize to develop a free educational ebook for consumers that provides information about prescription medications. So we're talking today about medications. It is Talk About Your Medicines Month. Why do we need to be thinking about this? What's the issue or concern, Linda, that we sort of need to make people aware of?
Well, there are over 4 billion prescriptions that are written every year in this country, and what's really concerning about all of that is that there have been some studies that show between 50% and 75% of those prescriptions are not used correctly. The results of this can be hospitalization, a worsening of your condition, or even death in the worst circumstance. But many hospitalizations are due to the fact that people are not using their medicines correctly.
Wow.
It's kind of mind-boggling.
Those numbers are incredible. 4 billion prescriptions a year.
Yes.
I may be responsible for a handful of those, but 50 to 75% are not used correctly.
That's right.
So how did we get into this mess? What do you think has gone wrong that has led us to, number one, making so many prescriptions? Because I don't think there's 4 billion people in this country, but that over half of the prescriptions are used incorrectly. Where did we go wrong?
Well, I think the intention has always been good, is that, physician sees a patient, the patient comes in with a problem, and if there's a medication available to treat that problem, they're going to write the prescription. Now, what happens after that is part of the problem. Sometimes patients come away from a doctor appointment. They don't quite remember what the doctor said about their medicines. They go to the pharmacy. The pharmacy is kind of busy, and they're afraid to ask questions about their medicines. And so what happens is the patient comes home and realizes, hey, I'm not really sure what this medicine is for. I'm not sure how to use it. And then that kind of perpetuates the problem. And I think a lot of consumers are afraid to ask the questions that they need to about their medicines to be wise consumers. And I think one of the big messages of this campaign, and has been for the last 30 years, the Talk About Your Medicines campaign, is that patients need to ask questions, and they need not be afraid to ask those questions and become proactive about their medicines. And FamilyWize.org is very concerned about this issue, and both from a quality perspective in terms of patients using their medicine safely and effectively, but also from a savings perspective, because as I mentioned, with all those prescriptions being filled, there's gobs of money that's being spent on those prescriptions, and a lot of the times, just as in the case of medicines and not knowing how to use them properly, patients are afraid to ask about, well, what's the best price I can get on this medicine, and how can I save money on this medication? And there are some definite things that people can do to try to save money. So it's really a combination of safety, effectiveness, and pricing that is of concern here.
You're listening to Dr. Radio and SiriusXM Channel 110. We're talking with Dr. Linda Bernstein. Talk about your medicines month. We're talking about some of the issues that come up which seem to get in the way of people being compliant with their medication regimen. You may have experienced this yourself. You may have some solutions for us through your experiences that you'd like to discuss, or you may be going through a hard time right now. Are you able to understand what you're taking? Are you scared about interactions? Are you able to afford your medications? Have you had a conversation? Give us a call, 1-877-NYU-DOCS. That's 1-877-698-3627. The lines are open, and we're happy to talk about your medication compliance issues. If we feel comfortable, obviously we'll answer your questions as best as we can. Sometimes, though, people call in asking for about very specific things about their medicine, side effects, what dosage that they should be taking. Of course, we're going to refer you back to your clinician. But if you have an experience where it's been difficult to comply with your medicines, and you want to share that with us or ask advice, of course, 1-877-698-3627. So let's talk a little bit about cost, Linda, because I hear that a lot in terms of copays and people looking to get their medications from, internet sites, websites from other countries. What are your thoughts about this, cost driving people to websites to get their medications?
Well, let me start with a good website, and that is FamilyWize.org. That's Wise is spelled with a Z, so it's FamilyWize.org. And the reason I bring that up is because we have two excellent tools on the website that we'd like your listeners to know about. First of all, we have a prescription savings card, which can provide a significant discount for people who are insured or uninsured. It's really available to anyone who wants to try to use it. And I say tries because it's not always 100% usable depending on the situation, but 8 out of 10 opportunities it does achieve a savings. So that's something and it's free and it's available on FamilyWize.org. Secondly, we have a drug price lookup tool. Now, a lot of people don't think about shopping around for their medications because they develop a loyalty to their pharmacy, and that's a good thing. But for people who are on a lot of different medications, ones that are expensive and starting to take a chunk out of your pocketbook, we have a drug price lookup tool. So you would put in your zip code, for example, and list the medications that you're taking, and it would provide a listing of the prices for that medication in your area. So that could be a useful thing to know, and that way when you're coming into the pharmacy, you already have an idea of what the cost might be. So those are two things. And thirdly, we have a new ebook, which I helped to write, and it's all about how to use your medicine safely, effectively, and economically. So those are some great tools for FamilyWize.org. Now, going back to your question, I think there are some definite dangers about people who go to what are called kind of rogue websites and think they can get medicines for cheap. And there are some definite dangers in doing something like that. First of all, the site might not be an approved site. And one way to find out is no matter what state that particular website originates from, it has to be approved by and licensed by the State Board of Pharmacy. And there is a listing of legitimate websites on the National Association of Boards of Pharmacy website. So that's something that people can look up. Also, there is something you might see on a legitimate website, which is the letters V, like in Victory, IPPS, which stands for Verified Internet Pharmacy Practice Sites. And that's a kind of a seal of approval by a National Association of Board of Pharmacy that this website is an okay one to use. The other thing to look for on those kinds of websites is that there is a licensed pharmacist available. That's very important if you have any questions about your medications that you're getting. Thirdly, that you should have a prescription from a licensed physician. Any website that wants to give you a prescription medicine without a formal prescription from a physician is doing so illegally. So that's a definite red flare that website is not okay. Also make sure that there's contact information for the website in general, because there are times where you might want to call and find out some more information. And again, being proactive about your medicine. If you get a medicine from a site like that and it just doesn't look right, it doesn't look like anything like the medicines you've had in the past, it smells funny, looks funny, don't take it, and definitely report it to perhaps the Board of Pharmacy in your state, or and so just be cautious about that.
Right.
And if the prices are so good, they're too good to be true, they might be too good to be true, because there have been cases where people have received medications that are counterfeit, that are not the same medication they thought they were getting, that are not effective because they're just have fillers in them and not the active ingredient. So one has to be very careful about using those kinds of websites.
As they say, buyers beware, and there's some red flags that people should look out for when they're using websites. And
I think Doctor, there's some better things that people can do, in my opinion, to save money on their prescriptions. First of all, they should make sure that they're only using the medications that they should be, and they're using them properly, because you want to get the most out of your medicine. So that's a very important thing, and I can talk to you about some of the ways to know you are. Secondly, ask about generic medications. A lot of insurers have what are called tiers. They have a formulary or a drug list. The low-tiered medications that are on the list are ones that are less expensive, and generally those tend to be the generic medications. And in most cases, you can use a generic for a brand. There are a few rare exceptions to that, but that's definitely something that you should check out and see if either there's a generic medication that's available or one that's an alternative to the one the doctor has prescribed that might be less expensive. So, and besides that, I would say the other thing to do is check with your insurance company and find out if there's a preferred pharmacy that might be good to use. Also, prescription savings card, as I mentioned, FamilyWize.org has a prescription savings card. And just be aware that again, the generic route is one that will definitely get you most of the time to a less expensive but equally effective product.
One of the biggest complaints I hear from some of my patients, and I don't prescribe a lot of medications, but I do review what medications have been prescribed by other physicians, and that is that in our healthcare system, people tend to see a lot of different doctors, and each one seems to write a prescription or two, so that at the end of the day, you see 3 or 4 doctors, you may have anywhere between 10 and 20 medications, and certainly as we get older, we seem to accumulate them. We call that polypharmacy, so many different medications. So, number one, how much of a problem do you see this as being? And number two, if somebody is on a handful of medications, what's the best way that they can organize themselves so that they remember, this one I take twice, this one I take once, and this one I take every other? How do people keep a handle on this?
That's a great question, and it's a growing problem because as we age and as the population ages, you tend to take more and more medications for more and more ailments. And one statistic that is kind of illustrative of that is that the elderly population comprises about 13 to 14% of the population, but they use about 40% of the medications. So that gives you an idea. And in terms of polypharmacy, there's some definite things that you can do to make sure that you're not taking any unnecessary medications. And as you mentioned, people do go to quite a few different physicians often, especially in this day of specialties and things like that. So first thing you can do is try to become loyal to one pharmacy, and that pharmacist can keep track of all the medications you're taking. And what the goal would be is to develop an ongoing drug list of all the medicines you're taking. Now, some pharmacies will even list a medication not filled at their pharmacy, and they will also include over-the-counter medicines and herbal products and other vitamins you might be taking. So make sure that your drug list with a pharmacist is complete. That's your best sort of clearinghouse for all the medicines that you're taking. Carry that list with you whenever you go to a physician, because that way all of the physicians who are prescribing for you will know about the medicines that another doctor is prescribing. So that's also very important. Now you asked about organization. There are different ways to get organized, and one of the best ways to do that is to take all the medicines that you use, put them in a brown bag, and set up an appointment with your pharmacist. They can go through all the medicines you're taking, make sure there aren't any duplicative medications, make sure that you're not taking ones that are expired, and help to screen for drug interactions in that regard. Also, if you're having a side effect from a medication, don't be afraid to ask about it. And in terms of also just getting organized, there are some other tools that pharmacists use. One's called the medication taking calendar. Ask the pharmacist to set up a calendar for you that takes into account whether the medicine can be taken with food or whether it's supposed to be given in the morning or at night. And that can be useful. There are other non-electronic kind of organizers. They're called MediSets, where you can put your pills for the week in that MediSet. But
like a pill box?
Kind of like a pill box, but it's like Monday through Friday, or some of them are actually different times of the day as well. So it's a bigger grid, not just days of the week, but it's also hours in the day.
Right, yes. When I say pill box, I don't mean like a box where you mix all your medications together. They should be, clearly, put in different sections, as you say, for the days of the week, for the times, and different medications.
That's right. But one thing to keep in mind about the only downside of those is that sometimes they're not 100% child-proof. And so if you have young children around the house, make sure that you store all your medicines in a cool, dark, dry place out of reach of children, preferably in a locked cabinet. So that's something to keep in mind for safe storage of your medicines. So those are there are now also lots of higher tech kinds of organizers that are out there. There are pill reminders that beep when it's time for you to take your medicine. So there are lots of different ways to get organized. But I think the first step is to just go through all the medicines you're taking, bring in everything, herbals, vitamins, over-the-counter products, anything that you take, even on occasion, and that includes also topical medicines like creams and eye drops and things like that, and make sure that you're only taking the ones you need. And if for some reason there's a problem that's detected by the pharmacist, they can help you and contact your physician and ask any necessary questions.
All great advice. Linda, we're going to soon run out of time, which is always sad because there's always so many more questions to ask. But I had another one for you, and that is sometimes, when people have finished taking a medication, there may be a few pills left over, or, the prescription has been changed. And, we seem to have more and more bottles of pills in our cabinets, and many of them we're not taking. And that, I think, also is a source of confusion in terms of the more bottles of pills you have, the more you can misunderstand or take one that you shouldn't be doing. How do people dispose of their medications correctly?
That's a great question. And because medications are expensive, we tend to say, well, I'm going to hold on to this. Maybe I'll use it the next time or something like
next
that.
year.
And that's not good because medications do expire and things like that. So the best thing to do, there's a couple of different options. I would say three. First of all, you can take all your medicines and that are to be disposed. You can take them out of the original container, block out the information on the container if you don't want anybody seeing what medicines you're taking, and put them in a plastic bag that's sealable. And in that plastic bag with the medicines, add coffee grounds or kitty litter or dirt or something to make those medicines absolutely unpalatable, so no one would want to taste them after you've thrown them out, and then put it directly in the trash. I wouldn't put it in like the bathroom garbage where kids could get a hold of it. I would just put it directly into the trash. There are some medications that can be flushed, and you can ask your pharmacist about that. There are also lists of those flushable medicines on the FDA.gov website, and those tend to be ones where even taking one pill could be very dangerous for anyone. So those tend to be like narcotics and controlled substances where you just want to get rid of it and don't let it even sit in the trash. Thirdly, there are programs in the community at local pharmacies through the Public Health Department and Drug Enforcement Administration where it's called a Drug Take-Back Day, where you can bring your expired medicines and they will dispose of them for you. So if you don't want to deal with doing it yourself, there are ways, and you can check it out. So make sure that you just don't dump them in the garbage, and then they could be accessible to a child or someone who wants to delve in there.
Is it ever advisable to share medications? You know, I have the same condition that you have. I ran out of my pills. I'll borrow one of yours.
Absolutely not. Medications are a very customized kind of thing that we take in, and just like you don't like to share shoes or you don't like to share underwear or something like that, you definitely don't want to share your medicines. And, you know, every medicine that's prescribed is done specifically with lots of factors in mind: your kidney function, your liver function, lung function, what your particular medical condition is, and also most importantly, what other medicines you're taking, because drug interactions can occur. So I would definitely recommend for those kinds of issues, check back on FamilyWize.org, where you'll find the ebook, which has lots of useful tips such as that, and what questions to ask your pharmacist to make sure that they're aware of all the medicines that you take, and you're aware of how to use your medicines safely, correctively, and also to save money.
Most importantly, be proactive. Try to develop that relationship with your physician. Try to develop a relationship with your pharmacist. Have that conversation so that you can keep things out in the open and get the full information. Write things down as well. I find when people come to see me, if they write things down, they take away much more with them. Dr. Linda Bernstein, I want to thank you so much for the time you spent with us and the information that you have for us. Really very valuable.
Great.
Thank you, and good luck with Talk About Your Medicines month. And the website was FamilyWize.org, and Wise has the Z in it. So thank you, Linda. Good luck.